Now we shall discuss regarding the blood supply of your thyroid gland. Okay, so when it comes to the blood supply of your thyroid gland, let me first draw your thyroid gland like this. This is your thyroid gland. Okay, now if you look at the blood supply, guys, blood supply is very, very important over here. Blood supply starts from the arch of aorta. Okay, so let us say that this particular thing over here is your arch of aorta. Okay, this is your arch of aorta. Now within this arch of aorta, you have got one very important thing. What is that? What is that? Here you have got something called as brachiocephalic trunk. All of you know that here you have got something called as your brachiocephalic trunk. I'll just tell the names now, I'll write it later. Okay, so this is your brachiocephalic trunk on the right side. This brachiocephalic trunk will divide into two branches. One is called as your right subclavian artery. Another one which is going up is called as your common carotid artery. Okay, so the right side going one, brachiocephalic trunk dividing into two, the artery which is going on to the right. So actually this is how it goes. This is the, what is this? This is your arch of aorta. Okay, here you have got brachiocephalic trunk. Not exactly here, I'm just telling you. This is brachiocephalic trunk, which will divide into two branches. One branch goes to the right hand, that is called a right subclavian artery. Another one goes into the neck, that is called as common carotid artery. But left side में ना ये ऐसे सीन नहीं है. Left side you have got left common carotid artery like this. Left common carotid artery you have got, and what do you have got? Left subclavian artery. Left subclavian artery. So all these are separate. So let me write down the names for this. This is your arch of aorta. If you already know these small branches and all, you can just forward the video. My teaching will be completely from the basic, so that those who even don't know anything, for them it would be useful. So you can fast forward it if you already know this. So this is your brachiocephalic trunk, and this is your right subclavian artery. Okay, this is your common carotid artery on the right, common carotid artery on the left, और ये भी हो गया left subclavian artery. Now this common carotid, what is going to happen? Common carotid will divide into branches like this. This is your internal carotid artery, and ये हो गया तुम्हारा external carotid artery. Okay, the same thing. This is your internal carotid artery. Sorry, this is your external carotid artery, and this is your internal carotid artery. When I write, you'll understand. This is your internal carotid artery, and this is your external carotid artery. Clear? Now pay attention. What is the important thing? From the external carotid artery, let me draw with the green. Okay, it would be easy for you to understand. From the external carotid artery, you see a branch that is coming. Look here, you see a branch that is coming from external carotid artery. Okay, now this branch which is supplying above the thyroid gland, you call this as superior thyroid artery. If it is supplying below, you call it as inferior thyroid artery, but now you have to call it as superior thyroid artery. Now this will divide into two branches. एक हो गया anterior branch, एक हो गया posterior branch. See, one branch comes anteriorly down like this. ठीक है, और एक branch, दूसरा branch जो है it goes posteriorly backward. That is why I am drawing in a dotted lines. ठीक है, अगर ये thyroid gland है, एक सामने आ गया और एक पीछे. So one is anterior thyroid artery and the other one is your posterior thyroid artery. Okay, anterior branch and posterior branch. So what is this artery over here? This is your superior thyroid artery. Superior thyroid artery में कितने branches है? One is your anterior branch, another one is a posterior branch. I'm writing it here, I don't want to mess it up there. Okay, अभी ये सेम पिक्चर जो है, सेम पिक्चर ऑन द ऑपोजिट साइड एज वेल. Clear, all of you? Right, we are done with the business of the top part. Now let us go to the bottom. Now when it comes to the bottom part over here, ये right subclavian या left subclavian artery है ना? From each subclavian artery, see, from the right subclavian artery as well as from the left subclavian artery also, we have got two important branches coming out. First of all, what is the name of this trunk over here? This is called as your thyrocervical trunk. This is your thyrocervical trunk. Okay, now look what is going to happen. Thyrocervical trunk will give many branches. Okay, out of that one branch I'm drawing it here. Out of that one branch I'm drawing it here. Just look here. Thyrocervical trunk will give many branches like this. Out of that one branch goes up all the way, and is it going anterior to the gland or posterior to the gland? Posterior to the gland like this, back of the gland, and anastomosing with the superior thyroid artery. Here also the same. So this is how it goes, this is how it goes, this is how it supplies. Okay, this is how it supplies. Now you understood this, right? So how did what are the branches over here? Just let us discuss it fastly. एक्सटर्नल कैरोटिड आर्टरी है, वहां से कौन सा ब्रांच निकल रहा है? सुपीरियर थायराइड आर्टरी. सुपीरियर थायराइड आर्टरी हैज गॉट हाउ मेनी पार्ट्स? एंटीरियर ब्रांच एंड पोस्टीरियर ब्रांच. Okay, so anterior branch is coming anteriorly, posterior branch is going posteriorly. Next, from the thyrocervical trunk, you see another artery that is coming out. What is this artery? This artery is your inferior thyroid artery. अगर वो superior हो गए तो ये inferior हो गया, right? So this particular inferior thyroid artery will go posteriorly backward, and it anastomoses with the posterior branch of superior thyroid artery. Very clear? Yes or no? Yeah, ये anterior हो गया, ये posterior हो गया. Is it clear? So this is the supply of your thyroid gland. There is a blood supply of a thyroid gland. But there is one more important thing that I have to discuss. Okay, अभी ये brachiocephalic trunk है ना, इस brachiocephalic trunk से there is one important artery that comes and supplies to your isthmus also. अभी ये artery जो है, this artery is present only in 2 to 20% of the population. Okay, in very less population you find this artery, and this artery most commonly it arises from the brachiocephalic trunk. Not only brachiocephalic trunk, from other branches also, but most commonly it arises from the brachiocephalic trunk, and it is present in less number of population. These are the 2 points you have to remember, and the name of this particular artery is thyroidea ima artery. Thyroidea ima artery. Okay, so these are the branches. So this is the blood supply of your thyroid gland. But remember one more important thing. ये inferior thyroid artery जो है ना, okay, before I come back to this particular picture guys, one very important thing I have to tell you. Just follow whatever I am drawing right now. Okay, let me change the color. Which color should I use? So let me draw the nerve supply right now, which is very important, because here you have to know many clinical points. Okay, so what is the nerve supply over here? So the first important thing over here is this particular part. This is your vagus nerve. Okay, vagus nerve will give a branch like this. This branch over here is called superior laryngeal nerve. Okay, so what is this branch over here? Superior laryngeal nerve. Okay, now this particular superior laryngeal nerve, look here, this is superior laryngeal nerve. This particular superior laryngeal nerve, see, this is your superior laryngeal nerve. Guys, closely pay attention. This superior laryngeal nerve is passing very close to which artery? Superior thyroid artery. And suddenly what will happen is that this will take a turn like this and passes deep to the thyroid gland. Look at the picture very carefully. Okay, what has happened here? What has happened is that superior laryngeal nerve has come here, and this nerve initially along with the superior thyroid artery traveled, but as it is reaching the gland, ये point बहुत important है guys, as it is reaching the gland, दोनों separate हो गए. Okay, as it is reaching the gland, both of them got separated. Okay, so keep this thing in your mind. So this is your superior laryngeal nerve. Superior laryngeal nerve. Now, if you come down over here, if you come down over here, now what I'm drawing is a recurrent laryngeal nerve. Okay. Now, if you look at the recurrent laryngeal nerve, let us say this is the main trunk over here, and here you have got the recurrent laryngeal nerve, right? So this is the main trunk over here like this, right? Now this is your recurrent laryngeal nerve. Let me write it down. This is your RLN. This is your recurrent laryngeal nerve. Okay. Now this particular recurrent laryngeal nerve. So now this particular recurrent laryngeal nerve, what does it do is this recurrent laryngeal nerve, this is your recurrent laryngeal nerve.